Hello everybody. So today we are going to see yet another new topic from a new subject, which is Nursing Foundation 2. In this we are going to see on a major discussion on unit number 9, starting with administration of medications. In that we are going to see a small subtopic, which is the factors which is influencing the medications. So starting to the introductory part, medications absorption, or might be the factors which influence medication absorption. The first and foremost would be medical formulation and the manufacturing process. Like for example, the chemical component which is used to manufacture the drug, and the multiple of combinations of drugs might be in a single drug, or many drugs combined together we give it to the same patient, which will be coming under the pharmaceutical factors. Next, you can say about the pharmacokinetic factors. So in this, the main reason we all know kinetic, it is the movement. So pharmacokinetic is the how the drug enters the body, might be through the oral or IV or subcutaneous, and finally reaches the distant organ, might be either the stomach or the intestines, because some of the drugs are enteric-coated, where it is not being easily dissolved in the stomach, but it is going to the duodenum and the ileum and finally into the small intestine, and then they break up, and then the liver is getting the drug consumption with the blood stream from the gastric mucosa, and thereby the liver metabolizes the drug, and the liver decides where the drug component can be sent in further. So that we all say like the drug absorption, distribution, metabolism and excretion process, which put together we would say it is the pharmacokinetics. Then the third component which also plays a major role in influencing absorption is that pharmacodynamic factors. Like for example, how the system reacts to the drug, might be the central nervous system, your cardiac system, your respiratory system, renal system, and so on. And fourth most, or you call the last most, must be patient related factor, because it depends upon each individual, because each individual have their own weight, own height, their BMI is different, the basal metabolic is different. Maybe some patients have one single diagnosis, some other patients will be having two or more diagnoses. So this also depends upon like why or the individual variant. Like for example, one patient you give one single drug for headache, patient is relieved. To another patient, maybe patient B, you give the same drug, they are not responding or they are not reacting. Maybe they need to increase the dosage, or they need a combination of drugs to relieve the headache. So according to the individual wise, that is patient wise also, the drug absorption will be varied. So coming to the drug pharmaceutical factors in detail, so it depends upon the drug formulation, how we prepare. Maybe the excipients, that is the drug stability, or the salt form, which is like if it is in the solute form, you can see the solubility is very faster, and depending upon the particle size of the drug, if it is smaller, the dissolution rate is high. If the particle size is high, then the dissolution rate is low. And it also depends upon the Enteric-coated factors, which some of the drugs are being protected against the action of renin, pepsin, and as well as hydrochloric acid. Some are being directly released into the small intestine. This is how absorption rate also varies. So next would be the route of drug of administration also plays a major role in absorption of drug. Some of the drugs when you give directly IV, it is very fast, might be 0 to 15 seconds or 0 to 15 minutes. The patient responds to the drug when it is being directly given into the bloodstream, because here it is bypassing the gastric region, and it is also bypassing the metabolism, where it directly enters into the bloodstream. Vice versa, if the drug is given through orally, then it has to pass many stages where metabolism is very slower when compared to the intravenous administration. Similarly, you have the other routes which plays a major role in drug absorption. So route of drug of administration also plays a major role in drug absorption. The next important factor, as we saw in the introductory slide, is pharmacokinetic factors. So in this, I told you how the drug passes from the oral till the excretory phase. That is the excretion of the unused matter of the drug. So here the pharmacokinetic factors might be, it depends upon the presence of food. So in some cases, for example, when a patient is having pancreatitis and if he or she is receiving the pancreatic enzyme, we have to give the drug along with the food. Vice versa, if it is given for a patient for cytoprotective action against the gastric mucosa, like for example, paracetamol. You give this drug along with like patients to protect the mucosal layer, we give tablet pantoprazole. So this is actually acting as a proton pump inhibitor. So when you are now requested to give the drug or you are given the order to give the drug, then it is our duty that this pan tablet is being given at least half an hour before the meals. So because if it is given along with the meals, it may hinder or it may decrease the drug absorption. So presence of food plays a major factor in absorption of drug. Next comes the blood flow. For example, if you give certain drugs under the sublingual, that is under the tongue, the absorption rate is very faster. But whereas you give the same drug through the gastric region, that is through the oral, it is getting delayed. So depending upon the blood flow at the particular site, the absorption rate varies. It may either decrease or decrease, increase or decrease. Next you have the GI motility. So the rate of the stomach empty and the intestine movements also plays a major role. For example, we would have come across in our lives itself, like when a patient is being suffering with diarrhea, where there is increased GI motility. So the drug is unable to sit or hold in a place and do the metabolism or the breakdown. Whereas 2 or 3 dosages after that only we could see the patient getting recovered. Similarly, for constipation it's vice versa. And in case of GI-pH, if the alkaline or acidity also plays a major role in drug ionization and solubility. Then, of course, surface area also plays a major role, such as you can see if the drug reaches the small intestine, the absorption rate is very fast because the surface area of the small intestine is very high. And the last but not the least in pharmacokinetic factor is that drug interactions. Certain drugs, when it is given along with other drug, it may interact or it may reduce the power of that particular drug, and that's why we are not giving certain drugs along with another drug combination. We may switch on to the regimen that is either in the morning or in the afternoon. Next it comes upon the drug distribution. So we all know how the drug is taking place in distribution of drugs. Maybe it reaches the blood flow and then from the blood flow it moves into the tissues and it goes and binds with the plasma protein. There is some amount of volume being distributed and finally you can see the body composition also plays a major role for drug absorption. Metabolism, how a drug enters and how a drug is being excreted from the body. It enters as soon as we ingest and then it travels to the liver. Once it reaches the liver, the enzymes act on it and after acting of the enzyme in the induction or inhibition phase, the drug passes the first metabolism and you can see there are changes in the genetic variation that affects the metabolism due to the rate. Finally, the fate of drug goes for excretion. So drug is being excreted either renal, biliary or other routes. If it is renal, you can see if any of the three factors, that is either the glomerular structure or tubular structure or the secretion or reabsorption is being altered, The patient can end up with impaired renal failure while ending up with either drug toxicity or drug accumulation. Vice versa, in case if it is excreted through the biliary, through the feces, and are some of the other routes where the drugs are eliminated within minimal is that the sweat glands, saliva, salivary glands, the breast milk, as well as some amount of through respiration. That is the lung. So some of the drug factors, or we call it as the receptor binding capacity, here is that it depends upon the receptor affinity, selectivity, density, agonist and antagonist. Agonist is something, a drug that responds to cellular responses. That is like might be, for example, you take a pill for fever to reduce the temperature. So you give antipyretic. It's doing the exact action. Antagonist is that actually it is going to block the receptors to prevent the cellular activation. Here the cellular activation is avoided. Might be you give an antidote in case of any poisoning. It is actually going to reduce the stimulation. Last but not the least, you have the cell, or you call it as the signal translation cycle. As soon as the drug enters, it goes and either attaches with the receptors, then the receptors are being activated, finally the signals are being amplified, and you get the cells getting stimulated to the cellular response. So drug interaction at receptor level, it is actually undergoing three major changes. One is the exact drug is going for, might be the effect is being started, might be on the other hand it can be vice versa, altered drug effect can be started or reduced drug effect, that is the power of the potency of the drug is very less. Finally comes the drug tolerance, is that as soon as we initially administer the drug to any of the individual, some of the drug is needed multiple times. For example, if you give an antibiotic, the patient is advised to take at least for 7 days or 5 days so to complete the course. In case if the individual is responding very decreased or minimum, then the dosage is titrated to higher level, and in case if the patient is showing or exhibiting heavy dosage or might be side effects, then the dosage of the drug is being used. Drug sensitization. So here the drug sensitization will be undergoing the initial response, then according to the repeated administration or continuity of use, there is increased responsiveness to the drug by the immune system, and hence the drug is going for enhanced effects. Patient-related factors might be due to aging, health status, might be patient existing with other complaints of drug, the comorbid conditions, genetic plays a major role, and lifestyle such as diet, exercise, and other social habits also influence greater role in drug. Last but not the least, to conclude, I would ask few questions. Which factor can slow down the absorption of oral medication? Is it empty stomach, increased blood flow, presence of food in the stomach, or liquid drug form? So we saw that in case GI motility, when we are discussing, the presence of food also plays a major role in slow absorption. So here the exact answer would be C. Yes, you are right. C is the answer. Second one, why is the medication action often prolonged in elderly patients? Whether it is faster metabolism or increased kidney function or decreased liver or kidney function, increased appetite. It's actually decreased liver and kidney function. How does body weight influence medication action? Heavier individuals require lower dosage. Lighter individuals require higher dosage. Dosage may be needed to adjust based on weight. Body weight has no effect on the drug. No, D can't be the answer. Always we depend upon, when we do the drug calculation, we depend upon the patient weight. So C will be the answer. Which of the following psychological factors can alter the effectiveness of medication? A. Is it the route of administration? B. Emotional. So here psychological. So I think this is the key word, that is emotional status and expectations also play a major role in the effectiveness of the drug. Then in patients with liver disease, drug metabolism is usually faster, normal, slower, unchanged. I told you that liver is the only organ which will be deciding how much percentage and where the end organ is being targeted. So here, if in case if it is a liver disease, then the liver is unable to do the process faster. So C is the answer. So these are the some of the common references which I've taken from Nursing Foundation. And that's all for today. Stay tuned to hear more videos from me. Don't forget to subscribe and like and give your comments. Please put on your feedback so that I can move on with new topics. Thank you.